What is the situation there in India now, Reena? Are you all quarantined at home?
Yeah, we've all had a lockdown. That's what our Prime Minister called it. It's a lockdown. We have been asked not to leave our homes at all and
Yeah.
only to go out to do local purchases and more order things so that they come at the doorstep. And things are so that you're not exposed much. So that people leave it at the doorstep and then you collect it from the doorstep. And to try and do more of cashless transactions. So not to touch any notes and coins and things like that.
Are there any ophthalmology clinics that are operating now in India?
Yeah, we all open, but only for emergencies.
Okay. What would be considered an emergency?
The cases like, sudden loss of vision, sudden, when they get floaters, or if they have severe redness in the eyes, like conjunctivitis, if there's pain, there's loss of vision, there's trauma, injury to the eyeball, those are the emergencies, yes.
And Reena, now the situation in India, I remember we were all at the AIOC not long ago, just outside of Delhi, and people were not wearing masks there. We were all greeting each other very socially. Wow, the situation has changed so rapidly. What happened and what's going on there now?
So similar thing is happening here as well, like all over the world. People have gone into social distancing. We were supposed to be having a couple of conferences and little meetings and all, which have all been cancelled.
Yeah.
And we are having more and more of these webinars so that
Uh-huh.
doctors sitting in their homes can connect. And there is Zoom also. So there are a lot of other different portals of which we can benefit and we can take and even keep sharing our knowledge, especially COVID-19 and how exactly one should take care of it because it's such a new thing and not everybody is well versed. So we had a very nice webinar with the doctors from the All India Institute of Medical Sciences, the pulmonologists and critical care doctors who answered quite a few questions, which we all were quite anxious about. So they were quite well addressed.
These digital ways of connecting are still very educational, very helpful in this day and age.
Absolutely. So almost every day we have some sort of a webinar happening here, and it's interactive. And I think we're all looking forward to it also now that we've made time for it because we have enough time on our hands. So I think it's a very good option of not getting too close to too many people, and yet the goals are met.
Reena, are you continuing to operate at all now?
Not at all. No, 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 not anymore. None of the cataract surgeries and the routine surgeries are being performed. But we are yet open for any, trauma or any other emergency that comes our way.
We're here at home with you in Canada, is that right?
That's right. That's right.
And you're
I've been
quarantined?
I've been at home since March the 13th.
Wow.
Yeah.
So what's happening there in Canada on the ground? Most ophthalmologists are home now, or just emergency surgeries going on?
So yeah, I mean everybody is closed except for emergencies, and the guidelines have been put out by the various societies. So the Retina Society has its guidelines, the Glaucoma Society, the Pediatric Society, but essentially it's just emergency patients that should be seen.
Okay.
And the rest of it's being handled by telephone.
So those guidelines, are they being posted at the respective societies? How do you find out about what they are?
In Ontario, we have a sort of a web forum that most of the ophthalmologists belong to, and the societies have posted it on that web forum. And then the Federal Society, Canadian Ophthalmological Society, has also posted the same guidelines. So there's a number of ways that we can access that.
How is ophthalmology faring right now in Canada? I guess most is shut down. Do we expect things to recover fairly quickly with clinics going back to work in relative short order, or do you think it will take time?
So, Matt, I think that's a fairly difficult question to answer
Yeah.
because I know most people are sort of pushing to get back into the office and looking at ways that they can protect themselves and looking at ways that they can protect the patients, in terms of wearing PPE and sort of pre-screening patients. But I think the reality is, until we have a treatment for this or until we know that patients are immune, we're not going to get back to normal. I know my American colleagues are pushing and they want to start doing refractive surgery and doing cataract surgery in private centers. But, I asked myself the question, why do you want to play Russian roulette? I mean, we know that you may not get it and your staff may not get it, but the next person who comes into the office who's 80 years of age may get it.
Yeah.
So unless there's a really good reason to see patients or to treat patients, I don't think we'll go back to normal until we have a vaccine or an effective treatment. So I see this going on for a while. In terms of the sort of the administrative approach to this, all elective surgery was canceled at the beginning of March.
Right.
And it still continues to be canceled, and probably through May it will be canceled.
So where are we now, Boris? Are we at your home in Moscow?
Yeah, I'm at home.
Okay. And you've been at home for some time now, I guess, due to the coronavirus.
Yes, actually, this is my, I believe, second week at home. So I'm staying now because the clinic is almost completely empty. So we have a couple of doctors on duty there to take care of emergency, but basically there is no reason for me, at least, to go there because of no activities.
Right.
So it's more or less the same with all, because we are a government-run clinic, so we are state clinic. So it's more or less the case with all the government clinics. It used to be more or less the same with all the private clinics, but yesterday I had a phone call from one company, and they told me that there are a lot of private clinics being for sometimes on the lockdown, and thinking to open up again.
Okay.
And not waiting till the end of that lockdown. So they try to, because actually they, of course, they are dependent on the cash flow and income. So they are thinking how to be a little bit more active and have some economic and economically viable situation, because right now it's not so good.
Well, I've started to see reports from the U.S. also how there are some that are interested to push the opening up. How do people feel in Russia? Do most people seem to want to reopen as soon as possible, or are people happy to stay in quarantine?
It's kind of a diverse situation. Depends on the profession you are and the economical situation, the personal economical situation predominantly. So, of course, a lot of people with who dependent on monthly income, they are not very happy to stay at home, and they are, of course, they are looking forward for the some ease of that situation. However, also people are scared with not being infected. So, and this is balancing more or less. And yesterday it was an interesting thing. So they tried to make a kind of demonstration online. So they went out to have kind of online expression of the unacceptance of the lockdown. So there are some moments, and even in the south, in the Caucasus area, there is a southern part of Russia, there were some people that are going out of house and trying to convene and to show up. They don't want the lockdown to continue.
What types of ophthalmic procedures are accepted at this time, acceptable to do?
So you know that interestingly, the government did not pose any restrictions on what type of procedure you have to do and what you have not to do. So there was a general recommendation by the Prime Minister, which was seconded by the Ministry of Health, that we should reconsider our planning activities. However, with not very much specification. So every clinic depends on their own internal rules and what is agreed within the clinic. So we agreed that there are some emergency conditions such as retinal detachment, such as acute closed-angle glaucoma, some inflammation, corneal perforation. And so we made a list of the emergency activities, of the primary emergency activities, then the second line, which is the intravitreal injections, whether or not to do them, because we do sometimes need to make them in a consistent manner, one by one, a loading phase and then continue per needed.
So among the different segments of our industry, I mean, you could kind of break it down to say cataract, refractive, glaucoma, retina, perhaps. Are you therefore finding that there are certain specialties which are really needed at this time? For example, for retinal and posterior segment surgeons, they're still fielding a lot of emergencies versus refractive surgeons who may be putting off doing that LASIK surgery.
Yeah, absolutely. Refractive department is completely closed. Okay. Cataract department is completely closed. Cornea department is also completely closed, although we have one person who can do emergency transplant if needed. So because for instance, in cornea transplants, there is still a debate how can we manage this virus that theoretically can contaminate the transplant. So there is no data so far about the corneal transplants and COVID, and a lot of the pathology departments, they are in the big clinics, they are full of the patients with COVID. So we are concerned not to transfer the disease to the person. We know that syphilis sometimes can be transferred with the corneal transplant. There were some reports on that. So there are some diseases that can be transferred with the corneal transplant. At least we know that.